we're the ones that can help educate the patients.
I think it's going to provide access to more primary care providers.
I feel like it's an honor that people would entrust me with their health.
This is a different way of thinking about health. This is a different way of approaching health.
It's the most rewarding thing that I've ever done.
I was a nurse for about 13 years before I decided to go back to school.
I had about 6 to 7 years of nursing before I applied to the DNP program.
I had been a nurse for right at 10 years before I had looked at furthering my education, wanting to be part of the process. That's what really appealed to me about the DNP program.
A lot of other programs have moved to a terminal degree. Pharmacy has occupational therapy, physical therapy, and it was really time for the clinical side of nursing to pursue that terminal degree so that we could evaluate the same studies and speak the same language and be able to sit at the table and help make decisions.
There are two paths to the DNP. The first path is for the master's prepared nurse to expand their education to a more leadership role. And then the second option is the bachelor's to DNP role that will include both the clinical components as well as the leadership roles.
I didn't have any managerial experience or leadership experience in nursing. I've always been a bedside type nurse. And so transitioning to a more administrative type role and a leader in the organization that I'll be working in is definitely something new for me.
It has really broadened the way I look at things in terms of staffing and cost and keeping supplies stocked. And then also, the quality improvement, to see that there's a gap in care and to think about, hey, there's something missing here, what could we do about it? And then learning to pilot and run programs to improve that gap in care or to improve patient outcomes.
You are being a provider, but you're also a communicator and you're an educator and you're, a mentor to other nurse practitioners, and you are the communicator with family and patient care, and so you kind of are jack of all trades, and you're constantly being pulled in all different directions, which you are in the DNP program as well. So you have message boards to do, you have assignments and papers and things like that, and in the midst of it you're thinking, I can't do, and once you do, you realize how strong you are.
Having the DNP program be an online program versus a live in-person program, you get the flexibility that you might not get with the on-campus every day going to class, and you're able to actually go to work and have that family balance with school that you might not get with a live in-person class.
It's almost all online except for just a couple of immersions, but students want that contact with faculty in those immersions. And, a lot of physicians don't want to hire nurse practitioners that don't have any contact with faculty because you develop that relationship with the student and they feel like they're a part of the university when they come to campus.
The thing that I've appreciated most about it, even though it is a mostly online degree program, is the fact that I can call my instructors and I can drive up to campus. And I have done that, where I've driven up to campus and talked to Dr. Shreve about some pathophysiology. Like, I want to make sure I'm really getting this, and it's hard to convey that over phone or over email or over Blackboard. And so just to be able to sit in her office with her and go through the book with her and talk some things out, that really helped me.
We were able to develop relationships with our fellow students through message boards and through Zoom meetings, just through the whole process.
These nurses who already live in rural or underserved area, because the DNP program is online, they can continue to live in South Arkansas and get their doctorate. And then their community actually watches them and grows with them. And so the community tends to be as invested in the nurse practitioner as the nurse practitioner is invested.
A lot of the professors that I had in school were very helpful and encouraging. They were there with me, along my entire program, really supportive as far as, mentoring me and guiding me and directing me.
Evidence-based practice is the bread and butter of how you treat someone.
There's, a massive need for evidence-based medicine, and especially community approach, and providing high level of care, and, all of that was, a common thread throughout the program.
At that doctorally prepared, as the nurse practitioner, it's all on you. When you're working for another provider who says, here's how I want you to do that, it makes you stop and say, this is not the way I want to practice. I want to practice this way because this is what the evidence shows is the most helpful.
They spend more time in research. They do get more statistics background. But there's also a huge clinical role that's completely different from working as a nurse.
A lot of people around here, they don't like to go to the doctor. They just don't. So, for them taking that step to come to the doctor is a big deal. Being able to instill that confidence in our patients from the first time that they walk into the door. And a lot of that comes with, the training that we had during school, but also using that evidence-based practice that's available at our fingertips as well.
You're going out there with evidence showing these treatments and procedures has helped people in the past through rigorous studies. And so that's why we want to focus on evidence-based and not just, this worked for this one person one time, and it should work for you though too. It's more than that. It's how do you help the most people doing this clinical practice guideline.
The doctorate program has the DNP Project, right, that we do, which is our kind of like our quality improvement project. In order to graduate, you have to find a gap in care at a site, and then implement an intervention and treatment plan to improve and fill that gap, and then evaluate it and see if it was successful or not, or if you had good outcomes and if it was substantial enough to implement other places.
They prepare you through those DNP classes as you're transitioning through the program to be prepared and ready for the project at the very end.
The steps that were needed through the DNP project, which is kind of the culmination of the entire program, putting all the things together. As I completed each aspect of that, I felt I learned a huge lesson, number one. Number two, huge life experience, meeting with these executive boards and, the big administration players in a hospital, trying to get your program approved or trying to get your project approved. You're actually doing something and implementing something. You have reasons for it.
Some of the DNP projects have been on congestive heart failure and trying to reduce the 30-day readmission rates. There's also been projects done on sedation break protocols for ventilator patients, trying to get them weaned off a little bit sooner. An early recovery after surgery protocol, which was implemented with a couple of surgeons and has actually gone hospital-wide. So all surgeons are using that program now, and that's in a local hospital here.
The number of doctorally prepared nurse practitioners over the past 7 years has significantly increased. There still is a huge need.
In our office, it is me and another nurse practitioner along with the 2 MDs that we have. Having those 4 providers there not only allows them to see more patients, treat more patients, being in a rural community, but we're also just able to share that burden load and be able to treat more patients and, address their needs on a day-to-day basis as well.
There's a great need to practice in a rural area because so many counties are observed as a rural county, and there are not very many providers in those areas.
I think if we can have more nurse practitioners, they'll have easier access to care.
Oftentimes, being in the rural area, you have to kind of have that basic knowledge of what the specialist would order and be able to get things going for the patient before they can actually get into that more structure, more specialized area, in the bigger cities and everything to get those needs addressed and taken care of.
Wow, that's a lot of responsibility.
Yes, it is.
We can fill that gap as a nurse practitioner, as a DNP, to step into that role and actually be the provider for those people that live in the counties.
Our area here in Northwest Arkansas is growing exponentially, and so being able to have access to not only primary care but to specialty services, I feel like nurse practitioners are really able to help fill that void. It's been so rewarding to be able to apply the knowledge that I've had before and learn from the people that I've learned before and apply that here. So it's been a fantastic experience.